This short video is going to be covering the topic of joint classification. There are two main ways in which we might classify a joint. Those two ways include by structure or function. When we classify a joint by structure, we're talking about the material that connects the joints. There are three main types of structural joint classifications. Those include fibrous joint structures, cartilaginous joint structures, and synovial joint structures. There are also three types of joint classifications by function. When we classify a joint by function, we're talking about the amount of movement that occurs in the joint. The three types of joint classifications by function include synarthroses, amphiarthroses, and diarthroses. In general, in an adult, fibrous joints are synonymous with synarthrotic joints. Cartilaginous joints are comparable to amphiarthrosis joints, and synovial joints are comparable to diarthroses joints. One thing that I feel it's important to mention is our joint classification by function exists a little bit more on a spectrum, as at different points in our lives we might have a joint that is more immobile compared to slightly movable. For example, the sutures that we have in our head, when we are young and little, especially coming out of the birth canal, those sutures are more slightly movable, and when we reach adulthood, or even into our late teens, those joints are much more immobile. So our functional joint classification exists a little bit more on a spectrum, whereas our structural joint classification, because it's based on the material, is very much more set. So the first type of structural joint classification that I'm going to talk about is fibrous joints. There are three main types of fibrous joints. They are all structurally very, very similar. It's just about where in the body they are found. The first type of fibrous joint is a suture found in the skull. The second type of fibrous joint is a gomphosis found at the teeth connecting the teeth to the skull. And then the third type of fibrous joint is a syndesmosis, also known as an interosseous membrane, found between the radius and the ulna or the tibia and fibula, connecting those bones into a immobile or slightly movable, so I'll come back up here, into a immobile or slightly movable, so a synarthrosis or amphiarthrosis, syndesmosis. The next type of structural joint classification I'm going to mention is the cartilaginous joints, which include synchondroses and symphysis. These are found mainly along the midline of the body. Our synchondroses are going to be here connecting our ribs to our sternum. Our symphysis are going to include things like our pubic symphysis or our intervertebral discs. If you break these words down, for example, synchondrosis, syn or sim means together or with. Chondro means cartilage, and osis is a condition of. So this is a condition of together through cartilage. Similarly, a symphysis means together or with, and growth. Physis is like growth or change or nature. So this is together growth, like a pubic symphysis or a intervertebral disc. So those are our cartilaginous joints, which are typically thought of as amphiarthrosis, particularly in adults. The last type of joint that we're going to cover, and it's going to be the main joint that we're going to talk about, are our synovial joints, also known as our diarthrotic joints, freely movable. Our synovial joints are more complex in structure compared with our cartilaginous joints or our fibrous joints. They comprise most joints of the body, and they're the joints that we typically think of when we think of joints. So, for example, as you're sitting there listening to this, you might be thinking of your elbow or your shoulder or your wrist. All of those are going to be synovial joints, diarthrotic, freely movable. I've already mentioned they're classified functionally as diarthrodal. There are characteristics of a synovial joint, and a few of those characteristics include that the bones that connect them have articular surfaces that will conjoin and meet, that they're covered in some type of cartilage, either articular or hyaline cartilage, that there's going to be a joint capsule that attaches the two bones that are meeting, and that inside of there, they're going to have a synovial membrane, synovial. That synovial membrane will secrete synovial fluid, which allow for more movement and allow for lubrication of movement. It's typically in a synovial joint that we're going to find ligaments. We'll also typically have a concave and a convex bony surface inside of a synovial joint. And that brings me to this point. Articular disc may be present between dissimilar surfaces. And here's a few examples of places where we have articular discs: in between the clavicle and the sternum, the ulna and the carpal bones, or the temporomandibular joint. There are many different types. So up here, we talked about our cartilaginous joints, and we talked about symphyses and synchondroses. There are many types of synovial joints or diarthrodial joints. And the type of diarthrodial joint is going to contribute to the possible range of motion here. So, for example, we have, as far as types of diarthrodial joints, hinge joints, pivot joints, gliding and planar joints, condyloid, saddle, ball and socket. This is the one we're probably most familiar with and the one that we think about. It's our shoulders. This one's our hips. It contributes to the most range of motion. But anyway, we have many different types of diarthrodial joints, and those types contribute to possible range of motion. I want to cruise ahead here. Here's a nice figure that you can refer to that are going to give you these different types of diarthrodial or synovial joints with their connection points between bones and how those bones are going to connect. So, for example, in a hinge joint, we're going to have one of the bones come down with a convex surface, and then we're going to have a concave joint surface which meets it, which contributes to a range of motion. You can look at these, a pivot joint here. I wanted to plow ahead onto this slide to give us a little bit more of a classification. I tried to break this down so that you can see the range of motion that is found inside of each joint classification. So inside of our uniaxial types of movement, so we can move, what this means, one plane. We can move in one plane here. So examples of a diarthrodial joint that moves in one plane are our hinge and our pivot joints. So a nice example of a hinge joint, I'll zoom in here. A nice example of a hinge joint is going to be our elbow, or our humero-ulnar is the more appropriate term. Elbow wouldn't be a appropriate term because that's also going to include our humeroradial joint, but our humero-ulnar joint is a nice example of a hinge joint that only moves in one plane, and that plane is the sagittal plane. The other type of uniaxial synovial joint is a pivot joint. An example of a pivot joint is our humeroradial joint, humerus to radius, where we have a joint that is, it can move in one plane along a longitudinal axis of another bone. So as we sit here, as you pronate and supinate your arm, right, you will see a pivot joint here where your humerus meets your radius, where the radius can rotate, it will rotate along the length of your humerus. So this movement occurs in the transverse plane. The next classifications of synovial diarthrodial joints are joints that can move in two planes, or biaxial. So our biaxial synovial joints include condyloid joints, ellipsoidal joints, and saddle joints. So if you think about your fingers, your metacarpophalangeal joints, where your metacarpals meet your proximal phalanx, we have two typical movements here. We have flexion and extension if you use your hands, and you can flex and extend your fingers. But the other thing that you can do is add and abduct your fingers. So there's two types of joint movement at a condyloid joint, and an example of a condyloid joint here is our metacarpophalangeal joints that move in these two planes. Ellipsoidal joints is like where our radius meets our carpal joints, or our radiocarpal joints, which again are going to move in the sagittal and the frontal plane with flexion and extension and AB and adduction, or radial and ulnar deviation. The last type of biaxial synovial joint is a saddle joint. A nice example of a saddle joint is our carpometacarpal joint of our thumb. Carpometacarpal joint of our thumb, which would be, I think it's circled right here. Let's zoom in so you can see. It's faintly outlined here. So our carpometacarpal joint. Again, planar movements are going to be flexion and extension in the frontal plane and AB and adduction in our sagittal plane. Another example of a saddle joint is going to be our, well, I'll skip that for now. We'll come back to that in class. Let me finish up our joint classifications of synovial joints with our triaxial, which are going to be joints that can move in three planes. So these are going to include our planar joints, which are typically thought of as our short bones of our wrist and our tarsals, or our wrist and our ankles, our carpals and our tarsals, where we can move in flexion and extension, abduction and adduction, as well as with some rotation in the transverse plane. Finally is going to be our ball and socket joints, which again have some flexion and extension, AB and adduction in the frontal plane, and rotation in the transverse plane. And that finishes this video of joint structure and classification.